Hi, in this video we'd like to talk about the earliest form of PCOS surgical treatment that was introduced back in 20-30 years ago, and how it has slowly progressed to what Antai Hospital is providing today, and how it is much more beneficial, and why previous methods are not so beneficial to the patients and disadvantages involved. So at Antai Hospital, we know that PCOS is caused by the presence of these abnormal tissues known as ovarian testicular tissues that are fused together within the ovaries, secreting high levels of androgens, leading to PCOS, and it can lead to infertility, symptoms associated with PCOS, miscarriages, anovulation, or oligomenorrhea. All of these symptoms. It is a hormonal and quite a complex condition as well. So PCOS has been existing for many years already, 30 to 50 years, and back in the days, 20-30 years ago, before laparoscopy was invented, before ovarian drilling technique, which is the conventional treatment right nowadays, the first form of PCOS surgery is known as an ovarian wedge resection. Now, this treatment is simply where the doctors, before minimally invasive laparoscopic techniques are introduced, back then they are still using transabdominal surgery. And then what they do is that they will remove a small wedge of the ovaries, which is a triangular wedge, removing large portions of the ovaries, and they believe that this will actually help these patients overcome infertility, overcome their problems of anovulation, because they also know that there is an abnormality within the ovary. They are not sure, they haven't identified that it was actually ovarian testicular tissue fused together as an abnormal tissue, but they knew that there was something wrong with these ovaries organically, and then they need to remove that. That is why the earliest form of treatment is surgery as well, ovarian wedge resection. And 50% of the time, these patients end up going for pregnancy, successful pregnancy, and a lot of the times these patients begin to ovulate again. However, it's not consistent as well, because the surgery is not specific. They end up removing large parts of the ovary instead of the abnormal tissue, because they have no way to actually clearly identify, clearly separate the two. So it has several disadvantages. For example, many patients don't recover, and furthermore, many of them end up developing premature ovarian insufficiency because of how much of the ovarian tissues are removed. And furthermore, because some of the surgery is not specific to the abnormal tissue, these women end up having much more severe PCOS symptoms, where the ovulations becomes much more infrequent, pregnancy becomes impossible to attain, physical symptoms like the acne and the body hair becomes much more severe, because they end up removing most of the ovarian tissue, the healthy one, and leaving behind the abnormal testicular tissue. That is why over time, with the progression of medical science, we progress into ovarian drilling technique, which is still a very inaccurate and ineffective treatment method. And after ovarian drilling technique is now what Antai Hospital is offering, which is the 3D laparoscopic removal of this testicular tissue within the ovary for PCOS patients. So what we do differently is that despite we also base our techniques with these previous two methods, which is the ovarian wedge resection and ovarian drilling technique, we still use the knowledge and the technique, but we need to clearly separate the abnormal tissues and the normal tissues. And how we do that is that we will use specific dyes to help us clearly identify. These dyes will allow us to clearly separate what is ovarian tissue and what is the abnormal tissue. And then using 3D laparoscopic surgery, we can only remove the abnormal tissue. Now that is the key goal, so that we can retain as much ovarian tissue, only remove the abnormal tissue, and then only we can achieve a successful outcome. And that's what we are offering here at Antai Hospital. For ovarian wedge resection, although they have clear good intentions, the techniques were not accurate enough. They were unable to separate what is normal and abnormal, and they were producing inconsistent results. Furthermore, they lead to POI, premature ovarian insufficiency, and they lead to several adhesions within the pelvic cavity as well, because back then there was still no laparoscopic surgery as well. So Antai Hospital does offer you now a highly specialized, minimally invasive technique with no adhesions, no scarrings, and we only remove the abnormal testicular tissue, and after recovery you will see that your symptoms subside. Oligomenorrhea subsides, you begin to ovulate every 28 days, and pregnancy can be attained now. So if you'd like to find out more information about previous techniques and what Antai Hospital is offering, the benefits, please visit the website, read our articles on PCOS, please watch our previous videos on PCOS as well, and get in touch if you'd like to find out more information or if you'd like to receive the treatment today.